Namaste. Let's understand nasal myiasis. Nasal myiasis refers to maggots in the nose. In this case, these maggots are larval stage of Chrysomia fly. This term, mya, means fly. Understanding the etiology. First of all, a destructive nasal pathology will occur. Examples are atrophic rhinitis, syphilis, leprosy, and infected wounds. Due to destruction of this nasal cavity, a foul-smelling nasal discharge will be emitted. This discharge will then attract Chrysomia fly. Chrysomia fly lays 200 eggs at a time, and within 24 hours, these eggs will hatch into larvae. These larvae are going to infest the nose, nasopharynx, and paranasal sinuses. Here they will cause extensive destruction. In India, they are seen predominantly from August to October. Let's look at the clinical features. In the first 3 to 4 days, the patient is going to have irritative symptoms. These irritative symptoms can mimic allergy, and they are due to maggots. So the symptoms are irritation, sneezing, lacrimation, headache, epistaxis, and puffiness of eyelids and lips. You can see that most of these symptoms mimic allergy. Only at the third or the fourth day, that is, only as late as the third or the fourth day, the maggots will crawl out and the patient will have a foul smell surrounding him. Extensive destruction will occur and fistulae may form in the palate or around the nose. Looking at the complication, one of the important complications is meningitis, because this can cause death. Let's understand the treatment. First of all, we will isolate the patient and use mosquito nets. This is to prevent the patient from reinfestation by the fly. Then, if the maggots are visible, we remove them with a forceps. Then we instill chloroform water and oil. This is going to kill the maggots. After killing the maggots, we will have to remove them. We remove them by nasal douching with warm saline. This is used to remove the killed maggots, the slough, and the crusts. Then before the discharge, we instruct the patient about nasal hygiene. Thank you. That's all about nasal myiasis, and you can look at the nose playlist for more nose related videos.